Hello once again. If you're just joining us, welcome to the Real Talk with yet another real conversation. Remember, we aim to have open and honest conversation. If you're just joining us, I'm your host, Luwumbe Jeremiah Mulanda, and today we are discussing all things integration of HIV prevention in family planning services, provision for adolescents and young people, a very important topic. Please tell a friend to tell a friend to tell another friend that we are officially live. You can follow the live show on our Facebook page at the Zambian Youth Platform or on all our social media platforms. I am not alone today. I am joined by two ladies. I will give them the opportunity to introduce themselves. I will start with Gezira. Please introduce yourself. Tell us who you are and where you're coming from and what you do.
Okay, thank you very much, Jeremiah. Welcome and thank you to all the adolescents who've joined in. My name is Gezire Tembo. I'm the Director Technical for Charles Aradri University, which is currently running an adolescent project for adolescent girls and young women between the ages of 15 to 24 called Rise Up. So we deal with HIV prevention as well as retention for adolescent girls and young women. Thank you very much.
Thank you so much. We are so excited to have you. Natasha, please introduce yourself.
Hi, Jeremiah. Hi, Jazire and Shadrick, and to everyone who has joined in. My name is Natasha Mwila. I am the 2022-2023 AVEC Fellow, and I am also the Advocacy and Information Officer with the Network of Zambian People Living with HIV. Mostly, I do work focused on advocating for HIV prevention amongst adolescents and young people, and really advocating for new HIV strategies such as the injectable PrEP and the PrEP ring, which I'm sure during this live show, I'll probably talk a little bit more about. So that's me. Back to you.
Beautiful. Great stuff. We are so excited to have you. And not forgetting our sign language interpreter, Shadwick Chansa. Thank you so much for joining us. And we hope that we can have a lovely conversation. Remember, you can send us your questions, your comments, your contributions here on the show, and we'll be able to read them loud and live to everyone who's on the show. Now, I wanted us to spend even just 5 minutes before we dive into our topic for today. We have intervals happening around the country, and let me take this opportunity to say thank you to the Ministry of Health for ensuring that this is done and all the other partners who have come on board. So we have the provincial intervals happening in all the 10 provinces. No discrimination here, all the 10 provinces. Then we'll also have the regional adolescent interval that will also be happening here in Lusaka. Now, I'll start with you, Natasha. What are your expectations of these two very important events from a young person's point of view?
Yeah, so I am so excited for the endeavors. You know, it's great to have such platforms where young people are able to come together and share experiences, live experiences, share stories, and really advocate for HIV prevention.
We seem to have lost Natasha there. Gazir, what are your expectations of the interval? I know you are excited. I know you're excited to come and speak to the young
Challenges
people,
and
interact with the young people. What are your expectations of the interval as Natasha tries to join back?
Okay, thank you very much, Jeremiah. So for me, the most exciting part about this is that this is the first of its kind. Like it's going to be the largest room where we're going to have adolescents across all the 10 provinces. And that alone is an exciting part for me because now it gives the youth the platform, or rather the adolescent persons, to actually make decisions for themselves. They'll be able to share their experiences at grassroots level, not at stakeholder level, saying, no, it's ZYP telling us the young people are going through this, it's Rise Up telling us this, it's NZP Plus telling us. But the young people themselves will be interacting with not only the stakeholders, but with the Ministry of Health, with what services they need to be delivered to them and what services they want accessed. So it's going to be an exciting platform, not only for talks, but to be able to share experiences. What is the HIV prevention strategy in Solwezi as compared to Lusaka? What are the statistics in terms of PrEP prevention, HIV prevention activities activities like PrEP and PEP. So that is something that the adolescents actually have needed and wanted for the longest period of time. The largest room where they can actually interact and talk about the issues that affect them directly, and they're able to share with decision makers. In this case, we're talking about Ministry of Health as well as different stakeholders like PEPFAR and just different large funders like the Global Fund themselves. So I think that is something very exciting for me because we're going to have all the people that need to make these decisions in one room. Thank you.
Great stuff, great stuff. And I hope we have Natasha back. But I also just wanted to, while I still have you, Gezira, here, for a young person out there who might be thinking, you know what, I'm not interested in health stuff, nonetheless, HIV stuff. What is your message to young people like that? And why is it very, very important for them to be a part of this conversation?
Okay, so we're looking at the period of transition. Adolescence is a very, very delicate period where a person needs to have the information and they really need to know where they need to access these health services. So things are happening. You might decide not to have sex, but there are issues of defilement, there are issues of rape, there are issues of family members sharing information about what family planning is. So this is a platform that the adolescents need to be able to get umbrella information in terms of what is family planning, what is PrEP, what is HIV prevention, because they need to actually have this information, whether or not they're indulging into sex. Because as we know, knowledge is power. So any form of ignorance will not actually save your life, but you need to have this information. In case anything happens, where do I go? Which stakeholder do I reach out to? Which facility do I go to? So for me, basically, even as I talk to the adolescents, it's very important for them to have this information because knowledge is power at the end of the day, and it makes them make informed decisions for their lives, not only health-wise, but also for their future.
Beautiful. Great stuff. Thank you so much, Gabriel. Natasha, the intervals will start next week. I am so, so excited. From a young person's point of view, what are you really, really looking forward to?
Yeah, thanks, Jeremiah. Sorry, guys, I dropped off the network. That wasn't a very good way to start. But yeah, what I'm really, really excited about is just what Desiree mentioned, just to echo her words. You know, it's a great platform where young people can come together and really share information, talk about really their experiences. You know, it's not only us sharing information with them, but then also listening to them, right? So it is a great platform, and I really do hope that during this endeavor, the possible outcomes would just not be coming together and it ends there, but really also having to what comes after that. What are these challenges that we're really also hearing from the young people? What is going on from the young people, and also just putting young people in the forefront, just to really have that meaningful youth engagement as well as youth leadership, because it's really, really key that we have the youth in the way of implementing, everything HIV, everything SRHR. They need to be involved. They need to be in the forefront as well. It shouldn't sort of be top down kind of information sharing, but really working together. And that should be some of the outcomes that I hope that will come out of the Indaba, that, continuous engagement with the youth. And it's just not any other meeting where, oh yes, I checked a box and I attended this meeting.
Beautiful. Great stuff. And if you want to register for these endeavors, please remember to visit the Zambian Youth Platform website. You can register for these endeavors in Lusaka. The Provincial Adolescent Health Endeavor will be happening from the 25th to the 26th. This is Lusaka and Copperbelt. Western Province, we have the 27th to the 28th of April 2023, which is also next week. And then for Muchinga, we have 2nd and 3rd of May 2023. And then for southern and northwestern provinces, we have 4th and 5th May 2023. And then 6th and 7th, we have Central Province, that is also May 2023. So we pretty much have everyone covered. What you have to do if you want to register for the provincial endeavor or the regional adolescent health endeavor is to go to the website, the Zambian Youth Platform website, and register, because like you heard the two ladies have mentioned, these are very, very important events. And if you have any questions around these endeavors, please feel free to ask even here. We'll be able to respond to them. And then also don't forget that Mwakula will have their Indaba on the 8th to the 9th of May 2023. So that's that about the Indaba. We'll keep building, we'll keep speaking about them. But let's begin to talk about all things family planning. So maybe just let's begin with definitions. What is family? What is family planning as well as HIV prevention? And why do we have these two conversations put together? I'll start with you, Natasha.
Right. So, my definition of HIV prevention would just really be focusing on the having to have the HIV prevention strategies, that prevent from transmission of HIV. So we do have different kinds of strategies or methods. It could be condoms. We do have pre-exposure prophylaxis. We do have post-exposure prophylaxis. So these and abstinence. We don't normally talk about abstinence as well, but that is also a way of transmission of HIV. So prevention, when we talk of HIV prevention, it's really all of these things that I've mentioned that help or really are used to help in the prevention of transmitting HIV.
Beautiful, great stuff. So when we talk about simply in a layman's language, we speak about HIV prevention. These are commodities that are used to prevent HIV. That is just what we're
Right,
taking from here. So like you rightly
right.
put it, we have condoms, we have PrEP, we have PEP. All of those are there to ensure that HIV
Is
is prevented.
right. And
Great
just to
stuff.
add point, also we do, like you did mention, we're talking of family planning as well as HIV prevention. So a little bit more on it, family planning. This could refer to really just having to plan, as it is in the word, in terms of like having to have a family. So this is where I decide as an individual, when do I want to have kids, how many kids do I want to have, and what are some of these methods do I need to use to really have a family. But then I think family planning is a term that's mostly used when it comes to maybe a marriage or an institution kind of a way. But I think when it comes to just young people and adolescents, Jazeera, you can come in and help me out on that. But I would also say we use the term contraceptive for people that are not yet into that family setup. I just wanted to add on to that.
Yeah, great. Beautiful. I was actually going to come to you, Gazir, and say, why should HIV prevention be integrated with family planning? I know there are people out there who are saying, Jeremiah, what are you speaking about? HIV prevention, family planning. Where is the link between the two?
Okay, thank you very much, Jeremiah. And that's an intriguing question, so to say. You see, we cannot talk HIV prevention minus talking family planning, because the common factor with these two concepts is what? Sex. So if somebody is basically having sex, then there are two things involved. They either are going to have unplanned pregnancies, or they are going to contract STIs or STDs. And worst case scenario would be them getting HIV. So if we're going to talk about family planning, which is basically the control of the number of children that one is going to have, or rather a couple decides to have, and at what intervals, we need to talk about HIV prevention. And because of that, both family planning and HIV prevention are all SRH outcomes, that is sexual reproductive health outcomes. And for the young people, it's actually a score if you have these services being provided as an umbrella service. So what do I mean? If we talk about youth-friendly spaces in the health facilities, you'll be able to see that you cannot talk about HIV prevention without talking about family planning, because one of the HIV prevention measures that you, Jeremiah, yourself, as well as Natasha talked about, is one of the measures that we also use to prevent unplanned pregnancies. Say, for instance, if we're going to talk about a condom use, that is a measure that will actually prevent you from getting HIV, as well as not having unplanned pregnancies. So even as we talk about family planning, we also want to ensure that most adolescents should not only be scared to fall pregnant, but they should also be, cautious of what HIV/AIDS is, because there's that illusion that we have to say, if I get HIV today, it won't show. Maybe up until I'm an adult, but we're looking at having a healthy and productive future. So we talk about family planning prevention measures, like we have the implants, we have the IUD, we have the condoms, and these are services that can be provided at the health facilities. But to make this more effective, if we want to integrate HIV as well as family planning, both terms should also be considered in what prevention measures we should use. So I cannot say that I'm going to take a pill for family planning and it saves me from STIs or HIV. I have to couple with obviously maybe a PrEP, that is pre-exposure prophylaxis, as my colleague mentioned, Natasha, or we have to couple it with a condom to ensure that we have a healthy, planned, and productive future for adolescents. Yeah.
Hmm. Beautiful, great stuff. Natasha, do you want to add on to anything?
Yeah, right. So I feel really it's very important to couple the two, like what Jazeera mentioned. You can't talk family planning without HIV, because what is involved here is really, indulging in sexual intercourse, maybe in unprotected sexual intercourse. So really, it is important because there are so many things. It's like killing two birds with one stone, one would say.
Mhm.
It is important to put the two together because there's so many if benefits that would come out of that. So instead of we usually have clients come to the health facility and they're only accessing family planning services. But now imagine a situation where we also couple that with HIV prevention messaging. Because usually women are very well, they usually go to the health facility to seek health, family planning instead of, HIV services, because this is something that we've been heard in the community. They would say, well, women are more afraid of getting pregnant as compared to getting HIV. So you find that they're going to seek family planning services more. So we need to really leverage on that. When a young person comes to the health facility, also give messaging on HIV prevention. As you're taking this pill or you're taking this family planning method, how about also you give information on HIV, on PrEP, on condom, because condoms is a triple, it's got a triple use. Is it a triple effective use? Because there's you talk of pregnancy, you talk of sorry about that. You talk of STIs as well as HIV. So it's really, really important to couple the two in as much as we talk of service provision, messaging, and everything in all.
Beautiful, great stuff. Thank you so much. If you're just joining us, welcome to the Real Talk, where we have nothing but real conversations. And today we are discussing integration of HIV prevention in family planning service provision for adolescents and young people. And remember, you can send us your questions, your comments, or your contributions here on the show, and we will read them live. I can see the chat is very, very busy. Hope there just says, good point, Natasha. I think it's important for adolescents to drive the strategy of abstinence. So even as we continue to emphasize HIV prevention, it's not just about using condoms, using PrEP or PEP or anything else. It's also about preaching abstinence, because abstinence is also very, very important. Enoch also says, following from Sioma, interesting topic of discussion. All in all, due protection is all that matters and a very good practice to bear in mind. Please continue sending us your questions, your comments, or your contributions. We'll be able to read them here. Now, I'll come to you again, Natasha. We have already established what family planning is, what HIV prevention is, and the link between the two. So, what evidence based interventions can be implemented to effectively integrate HIV prevention into family planning?
Right. Thank you, Jeremiah, for that. And it's really interesting, and it's funny to know that up until now, certain health facilities, some are doing that, but most are not. And I really do feel that if we get to integrate the two, some of the the strategies that can be used to implement this would just really be training healthcare providers. So we do have healthcare providers that are giving out providing the service of family planning. But then in turn, if we train those healthcare providers not only in family planning but as well as HIV, so that when they have clients coming in, they share all of this information together, as a package, that would really, really, save on a lot of costing. It would save on a lot of time, instead of a client coming from family planning going again to another department to get HIV, information. But having to train healthcare providers in all of these talk of family planning, HIV transmission, SRHR, everything, so that they will only have like a one-stop center where they just have all of this information. Another thing would really also be integrating messaging. We do have messaging going out on family planning. How about we also put in some prep, some pep? What is that? Because as we have already established, a lot of young people do seek family planning services, and there's very few information around prep. A lot of young people do not have a lot of information around prep or what prep is. So because they're already accessing the service of family planning, how about we also integrate messaging and bring in HIV prevention strategies? What are they? How can they be used? Where can they be accessed? Another I would add also, in terms of how it could also, where you get to access family planning services, we could also, have clients test. Mostly, I know it would be women that are accessing this, but if we're also providing HIV testing services at that point, at that center, then we'd be able to link, those individuals either to treatment and care afterwards. What do they need? Do they need, maybe prep? Also, because family planning does not prevent HIV or other STIs, but then in that discussion, or really the service provision, if we're able to test and know what kind of lifestyle does this individual have, do we link them to prep? Do they need PEP? Because even is it called a morning after pill? That is also a form of contraceptive. So because of that is an emergency, how about we also couple that with PEP? Because PEP is also post exposure. Because I may be at risk of having a pregnancy, but I could also be at risk of having HIV. So really integrating these things as some of the strategies to put together HIV prevention and family planning would work best. And I would also want to add also that in cases where women, there's this statement that men hardly ever go to health facilities to access, healthcare. So if we have women accessing a lot of family planning services and they get tested, so we could use that also sort of like a referral partner tracking, where if a woman tests, goes for family planning to seek family planning services, they get tested, they're able to make referrals to their partner who could also get tested. That way we're preventing transmission of HIV. So all in all, I feel some of these are, the strategies that could be implemented in order to, have the two integrated.
Thank you so much, Natasha, for that. Gazelle, I'll come to you. I have heard the different partners, different donors, different institutions, time and time again speak about evidence-based interventions that are backed up by data, by numbers. So when we speak about HIV prevention and family planning, what are some of those interventions that these health care providers, health facilities can begin to embark on, so that, like Natasha is mentioning, they are able to serve the adolescents better and young people.
Thank you very much, Jeremiah, for that question. I think we've seen a lot of improvement in the way the Ministry of Health is delivering the messages, and it's more accessible, and adolescents get to have this information. So for those of us who are privileged to be in the health sector, we're able to get these statistics from the Ministry of Health, and this is where our role comes in as ZYP, as Rise Up, as NZP Plus, to actually deliver these strategies, or rather statistics, to our adolescents at grassroots level. So the evidence base that we can actually talk about, that I would actually talk from experience, is what Natasha had made mention earlier. We talk about the condom, which has a triple effect way of ensuring that one does not get HIV and one does not fall pregnant. That is, if a condom is used consistently and if it's used correctly. But for my number one guidance or advice to the young people is what Natasha has really echoed, and we don't say this enough, that is abstinence. Because if you're abstaining from sex, you're not ready for sex, you're not going to worry about being pregnant, you're not going to worry about contracting HIV, which is a plus as you even develop and learn more about HIV. That is one evidence based approach. And if you cannot abstain, of which it's it sometimes happen, especially in the transition of young people, you actually now need to get more information. Do I need to use a condom? I couple it with family planning, or do I need to go the route of ensuring that I take PrEP, that is pre-exposure prophylaxis. But for PrEP, you need to ensure that you get an understanding of how it works, because PrEP will not prevent you from falling pregnant, neither will it prevent you from having an STI or an STD. So you really need to get all this information. This is why I mentioned earlier that knowledge is power. And via the Indabas, most of the adolescents will be able to get this information so that they make informed decisions, because we have a lot of myths and misconceptions surrounding our adolescents, especially in the community. And this brings me back to our roles as stakeholders to bring on board not only the adolescents, but the gatekeepers in the community. We bring in the church, we bring in the schools to be able to give the right information and knowledge. We can talk about how the schools have actually stepped up in the provision of the comprehensive sexuality education package. So that gives our children in the schools productive information surrounding knowledge about sex. But the other thing, if you look at that, the ultimate goal is not only to have this generation being HIV free or having planned children, but it goes to the next generation. Because if we're going to talk about sex right now and how to prevent it, how to prevent HIV, and how to prevent unplanned pregnancies, we'll see that in the next 20 years, we're going to have a healthy and productive generation, of which the government won't have to spend money on pediatric ART. They won't have to spend money on purchasing a lot of ARVs for the people in the country. Then we'll have ripple effects where we'll have more employment, we'll have youths getting into entrepreneur acts, because now that money that was going into that has been diverted. So it's more or less like a long-term goal, and this is why we have the vision 2030, because if we're going to prevent these HIV transmission now, it means we're safeguarding our future, because HIV coupled with family planning also ultimately prevents the prevention of mother to child transmission. We know that that is something that is mandatory from the Ministry of Health when a woman is pregnant, but if it should take a step further, that everybody should have the information and ensure that they get HIV tested, coupled with the right family planning method that suits to them, that actually speaks to their body, and that actually accepts the kind of environment that they are in. Thank you.
Beautiful, beautiful. You just brought to light a lot of issues that are really happening, and I like that you both have spoken so much about integration of these two very very important components. Because think of it like a supermarket. I like going to supermarkets because when you walk into a supermarket, you literally have everything that you need. You don't have to go from one store to another, to another, to another. So it's less hectic like that. Why can't we have services that are like that? As someone is offering, for example, family planning services, as Natasha mentioned, let them also offer HIV prevention so that we don't have young people going from one department to another, or one office to another. I like that so much. Let me go to the chat real quick. Chasila Banda says, this is an interesting discussion. I'm so happy that information is delivered to the intended group, adolescents and young people. In all aspects, sexual and reproductive health linkage in HIV increases effectiveness and efficiency and decreased duplication, effort, and all and including human and material resource. Very, very important point that she's brought up. It's important to have these conversations because resources are not split amongst organizations. Everyone is speaking on the same page. Everyone is speaking on the same page. And I like that so much. so much that you are following the conversation. Natasha also says good point. Because most people feel embarrassed to access HIV services, instead having put it in one package is a very very valid point. And then Doris also says, I love that you brought the idea of protection, but I think they should increase awareness on it. I definitely agree with you, Doris. We definitely need to increase awareness around condoms. And then Gloria also says, good topic following from Kuma Miles. Gloria, we hope Kuma Miles is okay. Chisenga says, panelists kindly say something around voluntary medical male circumcision with regards to the topic. Gazira, do you want to take that up so that Chisenga feels very satisfied? What is the relationship between GMMC with our discussion today?
Okay, thank you very much for that question. I was actually looking at it, and I think it's one of the strategies that Natasha and I didn't mention when we talked about the HIV prevention strategies. So we do have a number of strategies, and voluntary male circumcision is one of the most effective ones that we do have. But this has to be done in a health facility with trained health personnel. We know we do have some, we get to have information in the communities who can do this, who can do that. But if you go to the health facility, you're going to be guided on the procedure and how it prevents you from getting HIV. So it's one form of HIV prevention, which is not 100% effective. It just helps you reduce the risk. So if we're going to talk about VMMC, we're only talking about the reduction of the risk and not the actual prevention. So you need to couple your VMMC, just like we've spoken about family planning and all the other strategies. You need to couple your VMMC with another effective way of HIV prevention, which could be a condom or even PrEP. So basically, it's a step in the right direction. That is for males to go for voluntary male circumcision, but it doesn't entirely prevent you from HIV. I wouldn't even give a percentage to that because I'm not a medical personnel, but it's also very important to get more information even as we go to our nearest health facilities on how to go about the procedure and what we can couple VMMC with. But it's a step in the right direction, and it just reduces the risk. I want to emphasize on the aspect of the risk and not the prevention itself. Yeah, I hope
Thank you
that
so
answers
much.
the question. Yeah.
Thank you so much. I think Chisenga is very, very satisfied, and thank you very much for highlighting that. So remember, VMMC is very, very important. It's one of the measures to prevent, but like Kezira has mentioned, it's not 100%. This is why you need to use other methods, abstinence, PrEP, condom use, and any other of those important things. And remember, what is important is having the right knowledge when it comes to this various services. Now, we have spoken at length with regards to the link between the two. Now, what are some of the benefits? So, one out there might be thinking, okay, so what if we link HIV prevention with family planning services? What are the benefits? Natasha.
Right. Great question, Jeremiah, because one would wonder why are we going back and forth and having this discussion. And really, the benefits for me would really be on a lot more people will access, HIV services. I did see in the comment one said it would reduce stigma, because having to a lot of people go to health facilities not only to access family planning, but if in turn they can also access other services at one point, then you have a lot more people who are going to access, not only family planning, but HIV prevention as well. And it's going to reduce stigma because in a situation, I think currently what is happening is you can only access PrEP, or in some facilities, you can access PrEP from ART clinics. Already when it comes to PrEP, ART, the stigma that we are facing and that people are facing, stigma and discrimination. But then if this is integrated and it is being coupled with, family planning services, there's less stigma and discrimination. And again, it comes down to more people accessing it, and also it also comes down to just really minimizing on costs, or really maximizing on the resources. Because if we do have HIV prevention as well as family planning services being provided together, you don't have to have a lot more, maybe infrastructure. Maybe you use one room for those services. You don't have to have this room and that room. So in that way, you lessen on the cost on how certain services are provided. So these are some of the benefits of putting the two together, and also just having a lot more people also having information around HIV prevention, what it is, because it's very rare that people would have information on PrEP and everything that we've talked about in line with HIV prevention, but you'll find that they are very well conversant with family planning methods that are being used.
Mm. Yeah, I definitely agree with you. I definitely agree with you. Gazir, from a programmatic point of view, what are some of the benefits of integrating these two together?
Yeah, I'll still circle back to what I had mentioned earlier. You can't talk family planning um, and HIV prevention separately, because the common factor there is sex. So if we look at uh, the topic at hand, family planning in being integrated into HIV into HIV prevention actually brings out the ultimate goals of what is the core business of sexual reproductive health. So if we're going to talk about sexual reproductive health, if a person has started engaging into sex, um, they might either be HIV positive or they'll fall pregnant. That is unplanned pregnancies. That is if they're not being careful. So the benefit is that, like Natasha had earlier mentioned, you're killing two birds with one stone. You're ensuring that you're not having an unplanned child or birth, and you're ensuring that you're keeping yourself safe. That is through condom use, through abstinence, through pre-exposure prophylaxis, or even the pills. So even as stakeholders, even as parents, even as gatekeepers, we cannot shy away from talking about HIV prevention when we start talking about family planning. Because even just from the home setup, as you're growing up, your parents will actually echo more on you not falling pregnant when you're at school. But with the transition of this world, there's a lot of globalization. There's a lot of talk on TikTok, YouTube, Facebook about, things that is HIV prevention. It's best that we integrate the two so that we give our adolescents the right information. Because if you're going to have sex, it's not only going to be a baby coming your way, but it could be an STI, it could be HIV. So we need to ensure that even as we introduce the sex talk to the children, both terms are integrated so that they get an understanding. And ultimately, we want uh, an HIV free generation with planned children. Because even as we talk about prevention, we're ensuring that with HIV prevention, we are going to talk about prevention of mother to child transmission. So we're going to have a whole generation of children that are going to be HIV free, who are going to be more productive, who are going to be more healthy. So basically, you can't shy away from one term and leave out the other, because the act that brings them together is still sex, and you need to talk about both.
Mm. Beautiful, great stuff. Now we are coming to the close of the show. Unfortunately, time flies when you're having a good time. But what is the take-home message from this conversation to the adolescents and the young people, the healthcare providers, and the policymakers, the donors, whoever it may be? What is the take-home message? I'll start with you, Natasha.
Right. So I would just want to say or put this out to the adolescents that are tuning in. Really, HIV is there. I know there's a lot of low perception, a low perceived risk when it comes to HIV. That, well, because I have one partner, because I know the person and I know myself. So there's really that low perception, but really, I would just want to urge the young people to get tested, get tested frequently, and also do seek HIV prevention methods, because it's not back in the day. I think the notion that comes with someone who's HIV, it's because, well, you were promiscuous and you're going out there and living a wild life. But that's not the case. There's a lot of dynamics surrounding the HIV situation. And it could be that also right now the lifestyle is different with young people. There's a lot of transactional sex, a lot of having multiple partners. There's a lot of things involved right now. So you may think that you're safe, but you don't know what your partner is doing. So I just want to urge a lot of young people that are listening in, and also to not just them, but to also have normalize having this conversation when it comes to HIV. Talk about, just the way we talk about contraceptives, talk about HIV prevention strategies that you can seek at health facilities, because it is not a very common discussion that we have. So get tested frequently, seek for HIV prevention methods. It could be condoms, it could be PrEP. And when you feel you were exposed, you can go to health facilities and as well seek PEP and also VMMC. I just wanted to add that VMMC also has about a range of 50 to 53 um, uh, um, efficacy rate of reducing the risk. But again, I will write on what Jazeera said, to say it's also key to have combination prevention, because VMMC is not 100%. So couple it with using a condom. So again, I repeat myself: get tested, seek for HIV prevention services to protect yourself.
Thank you. Thank you so much, Natasha. Gazir, what is the take-home message from you?
Wow. I think I'll just ride on what Natasha has said. Just to weigh in that as young people, I think we have a lot of resources surrounding sexual reproductive health talks. That is in terms of testing, we have PrEP, we have family planning. So let's ensure that we utilize those resources. We utilize the health facilities. We utilize the stakeholders that are providing these services to us. I think we have a number of service providers in our communities that have actually come close to our communities. I'll give an example of our project like Rise Up. We're in the Copper Belt, we're in Lusaka, and we're in the heart of the community. So you just walk in and get more information, because the more information you have, you're going to make an informed decision. That is about your sexual behavior. That is whether or not you're ready to have a child, because all this is integrated, like Natasha has mentioned, at a one-stop service point. So ensure that you have all the information, Google it, ask questions, join platforms like this Real Talk where you get information, and just ensure that you find yourself in strategic places like the Indaba, because that's going to be like a vast room where you're going to network with different adolescents in different from different backgrounds, and they'll be able to share their experiences. So for me, the key take home from this is knowledge is power. Ensure you get as much knowledge as you have to, as you need, for you to make informed decision, not only for yourself but for your future ultimately. Thank you.
Thank you so much. Thank you so much to Gazire and Natasha for joining us today on the Real Talk. We were discussing all things integration of HIV prevention in family service provision for adolescents and young people. And many thanks to the people that also came through who joined via Facebook, YouTube, or Twitter. Really appreciate your comments, your questions, and your contributions. And remember, the beauty about the Real Talk show is that conversations continue. So continue asking those questions. We'll be able to respond, and we'll also be able to continue interacting on like-minded platforms. I just wanted to quickly mention that remember the provincial health endeavors will be happening. You can visit www.zyp.com to register for those endeavors. And when you are selected, your various provinces will be able to also offer further guidance on where the endeavors will be happening. And also remember that the regional adolescent health endeavor will be happening here in Lusaka on the 17th to the 19th of May 2023. Many thanks also to Shedrick, our sign language interpreter. I have been your host of the Real Talk live show. Thank you so much. From me, Lumumbe Jeremiah Mlanda, and the entire team, it's bye bye and see you next week.